There are certain diseases that older people are more prevalent in older people, and I'd like to talk to you about your approach to nutrition with certain diseases. Osteoporosis comes to mind. I read some of the things you wrote about osteoporosis and acidity and alkalinity, and tell me about that.
So I think that there's a misunderstanding about how much calcium someone might need, and there's also kind of an abuse of calcium supplements. So I'll sometimes have someone come into the office and they're on, high-dose calcium supplements and they're getting calcium in their diet, and then it's not balanced by magnesium, or they don't know about their vitamin D levels, or they're just having a diet that doesn't have any vegetables in it. So we have to look at the combination of calcium supplement and what's in the diet, because you don't really want to go over 1,000 or 1,200 milligrams.
Right.
And also to educate them that you can only absorb about 500 milligrams of calcium at any given time.
Yes.
So sometimes they're confused. They might be taking all 1,200 milligrams at once, and they're just getting this big overload in their body, or they're taking it at the same time. They're having cereal or yogurt, so they're just not getting the calcium, actually all that absorption in their body to begin with.
Yeah.
Or they might be taking it at the same time as an iron supplement, and that could be interfering. But calcium is not the be-all, end-all of osteoporosis. No. So you want to have a certain amount of calcium in the diet, but then you also need a good magnesium status, because magnesium helps calcium absorption, and magnesium also helps vitamin D absorption, and vitamin D is critical for bone health as well. So there's just more factors that go into it. And then what they're also discovering in the research for osteoporosis is that heavy meat based diet is not as beneficial for bone health as more plant-based diet. So then you go back to that benefits of all the plant-based foods. And even though some of them don't have calcium per se in them, they have so many other nutrients that are supportive for the bone, that's also helping prevent bone issues.
Yeah. I know that high protein diets in general can promote osteoporosis. And I also know that calcium intake in excess of what you need can be cardiovascular toxic.
That's right.
And so the recommendations have come down that we've recommended for supplementation of calcium. But I think the best way to get it would be food, of course.
Yeah, ideally it is food.
And the whole thing about dairy has changed, I think, recently. I understand we have to be careful where the recommendations come from, but I've been reading more and more about the benefits of cheese and about, of course, yogurt, but cheese and other whole-fat dairy products as being beneficial to people in terms of cardiovascular health and bone health. Have you read anything about sort of a change in attitude about dairy products?
Well, I think there is a trend towards kind of going away from all the low-fat products and embracing more just where the whole natural food comes from, so then you wouldn't be removing the fat. So I think there's still, I think the debate is still out there whether that's going to be more beneficial or not, because the whole saturated fat issue that's where the with the heart disease and and blood sugar and all, diabetes risks can be, I don't think we know yet. But whoever I'm working with, it sort of depends on what their whole diet is like. If they're eating more whole milk dairy, it shouldn't be like a big part of their diet, where they're having, cups of this. So if it's a small amount mixed with some berries and some ground flax seeds, then that's fabulous. It just depends on the overall amount, I think, of saturated fat and meat in the diet in general. So a good, clean whole milk dairy product, I think, or cheese, I think is fine in modest amounts.
Yeah, low sodium maybe.
Yeah.
Do you think can you tell me about the DASH diet? The DASH diet is around 20 years old, I think, 15 or 20 years old. And there's evidence-based medicine to suggest that it really does work on hypertension.
Absolutely.
But it's not followed by most people, I would say.
That's true. So the DASH diet stands for Dietary Approach to Stopping Hypertension. And it was done by the National Institute of Health, I believe. And they did a study, thousands of people were involved, where they put them on a very high amounts of fruits and vegetables. I think it was about 10 servings a day of fruits and vegetables. And then it was whole grains, a couple servings of low-fat dairy, a serving of nuts, a serving of beans a few times a week. And so it was very rich in all these amazing minerals and vitamins. And it was small amounts of animal protein and very low sugar. And so what they found, without even reducing sodium levels, they were not put on a low-salt diet, blood pressure levels dropped significantly.
Yeah.
And then they put them on a slight sodium restriction, and then they went down even a little bit more. But even with just the diet alone, without sodium, they saw results.
That's interesting. Do you know any people who are able to follow that diet?
I've seen many people that were just increasing their fruits and vegetables in general and decreasing their sugar, and blood pressure is absolutely coming down, even without the extreme 10 servings a day, which is challenging to get in, but not as challenging as most people think if you kind of know how to do it right.
Yeah.